Well, good evening, everyone. I was talking earlier with Andrew Dreyfus, who was also there back at the beginning, and because now that we're old, we trade those "do you remember when" stories. And I looked out at the crowd and I said, yeah, it's too bad this Schwartz thing never amounted to anything. The simple truth is, the Schwartz Center did amount to something very special. And if you bear with me for just a minute, I want to speak a little bit about at least some possibilities about part of why that happened. The dinner in the first few years was special, but in some respects it was special because it gave a lot of those of us who knew Ken Schwartz and really loved and admired him a chance to basically remind ourselves about what a very special person he was and how important it was for us to try to do something to live up to his vision and his legacy. And I remember about the third or fourth year, something really interesting started to happen. And it was right around the time the Schwartz Center started running rounds programs in some of the area hospitals. Was physicians started buying individual tickets to come to the event. Now, most people who run these events, they're always, for lack of a better way to put it, corporate tickets for the most part. Hospitals buy them, physician groups buy them, pharmaceutical companies buy them. But it's generally speaking an act of an institution, in many cases led by individuals there who believed in the organization and cared about its mission. But if you looked out at the tables typically that showed up at the Schwartz event in the first few years, a lot of them were sort of the traditional kinds of tables that people would buy, until all these docs just started buying tickets on their own. And it was the first time I got this sense that there's something bigger going on here. That this whole notion of creating an entity whose fundamental point of view and purpose was about human connection, human touch, compassion, communication, and this whole idea that there needs to be, in a world in which the science and the technology was moving at the speed of light, which in many cases was a really good thing, saving all kinds of people who would have been lost before, there was this possibility that this fundamental little ember of compassion, of connection, would be lost. And I remember I literally walked up to some of the docs who bought tickets to some of those early year dinners and just said, Charlie Baker, I'm on the board. We probably don't pay you enough. How come you're here? And inevitably, they would talk about that rounds program. And they would talk about the impact that it had on the way they saw their role, their patients, and the whole engagement between caregivers and people struggling with anxiety and fear and depression and a whole series of other concerns that in many cases were brought on by simply not knowing what was going to happen next. And we had a strategic meeting at some point shortly after that to talk about what the next act, or sort of the big branding opportunity, would be for the Schwartz Center. And the rounds became a big part of that conversation. Because here was a tool, here was a process that had tremendous meaning and value to people in the healthcare community, and it could be replicated over and over and over. And as somebody who spent a good deal of my time as governor dealing with this horrible, terrible, brutal opioid epidemic, The fact that the Schwartz Center would choose to put together a collection of rounds programs on this, in some respects, should not be surprising at all, but is just an incredibly powerful statement about how strategically smart, with its ear to the ground, this organization can be. It's hard to talk about addiction. I found that out when I was a candidate. Most of the people who wanted to talk to me about addiction waited till everybody else in the room had left. My wife tells me I wave my hands around too much. She also says I usually speak too long. We'll see how I do. But the reason they waited till everybody else left to talk to me about addiction is because they knew it made other people comfortable, and therefore it made them uncomfortable. There's an HBO documentary on the heroin epidemic, and there's a point in it where they have a whole series of interviews with parents of people who are dealing with addiction. And one of the moms says, you know, if my kid had cancer, everybody in the neighborhood would be over here every single night with a casserole and an arm around the shoulder and a, hey, what can we do for you? But because my kid's addicted to heroin and may die, I can't really talk about it, and neither can any of my friends. And in terms of organizations that have an opportunity, because of what they're about, who they are, and the trust that they've built up with so many folks across the healthcare community, to really make a difference in helping families and patients who are dealing with substance use disorder be able to speak comfortably about what's going on, I can't think of a better organization than the Schwartz Center. So many families, so much death, so much pain, so much loss. 50,000 people a year. 50,000 people a year. There is tremendous power in connection. There's tremendous power in that capacity to show empathy and support. And that's why I think all those docs just started buying tickets and showing up some 20 years ago. And it's also why I believe this organization is successful, and it's also why I believe it's important. And the fact that it now has a national footprint and is engaging with caregivers and provider organizations across the country is a terrific testament to Ken's original vision, but it's also a big statement about all the people from the very beginning until today who've been part of the group that's made the Schwartz Center what it is. Congratulations, and God bless you all.